Welcome, good morning, good afternoon, everyone. Welcome to the HOME-ARP Allocation Problem Solving Clinic. As you all are aware, HUD recently adopted a deadline to submit the HOME-ARP allocation plans by March 31st, 2023. Given that deadline, PJs really need to focus on completing and submitting a compliant allocation plan. Today, we're going to provide a brief overview of the HUD Exchange, where you can find several resources, trainings, and tools on HOME-ARP. We'll have a very short presentation providing an overview of the allocation plan requirements. And finally, we'll spend a majority of our time together in breakout groups. These sessions are going to be topic specific, and you can select the group or groups that you'd like to join. So as we said earlier, my name is Jessica Lurs. I am with Apt Associates, and I am joined by Carrie Kronberg with ICF. We will both be doing the presentation with you this afternoon or this morning, and then we will have several other TA providers in the breakout sessions when we move to that portion of today's webinar. So the first thing we'd like to do is just take a quick view of the HUD Exchange. The HUD Exchange has a number of really great resources and tools for everyone that we want to make sure that we call some attention to. So when you go to the HUD Exchange, the link that's in this presentation will take you directly to the HOME-ARP landing page. And on this landing page, you're going to find a number of different things that will be helpful for you. And today we're going to be reviewing a couple of those. So we'd like to show you where they are so that you can use them as you're planning and going through your allocation plan. So on the home page here, if you want to learn a bit more of the overview of HOME-ARP, you can click on the button to the right here. And if you scroll down further, there are several topics. So there's some policy guidance. This is where the HUD notices are and policies on preferences, methods of prioritization, URA and Section 105 briefs. You can find information on limits and allocations, reporting systems, and then we also have a number of IDIS videos. We'd like to really point you to the one on how to submit your allocation plan. With just about 2 months before that deadline, we want to make sure everybody reviews that and understands what the process is for submitting your allocation plan in IDIS. If you scroll further down on the page, there's a section called Resources and a subsection for allocation planning. And this is where we'd really like to point you so that you can start finalizing those allocation plans. You have your certifications and forms that need to be signed and submitted as part of your allocation planning process. There's an allocation plan checklist, which we'll talk about in the presentation later, but is an excellent resource for thinking about what do you need to make sure is in your plan so that it's compliant. Some common issues. We're going to talk a lot about an allocation plan template, so that's also here and available for you. And a couple of other tools that can help you as you're developing your allocation plan. In addition to that, there are a number of trainings that have been provided that are up here, but the one other section that we really want to point you to today is this HOME-ARP Allocation Plan Virtual Problem Solving Clinics. This is the materials that you would have received as part of your registration. But at the bottom of this page, there are a number of different sources for you to use, and you can take a look at some of the different handouts that we'll be talking about and a lot of the different tools. So if someone else could drop in the chat for everyone just a link to where we can find those handouts and the slides for today, that would be wonderful. Okay. So that was a brief overview for HUD, for the HUD Exchange. We hope that you'll go back and take a look at everything and use a lot of those resources and tools that have been made available. So we want to get to know you all just a little bit more. And in the chat, if you could answer these two questions. Where are you in the allocation planning process now? And what's the greatest challenge that you're facing in this process? We want to give everyone a few minutes to do that, but we'll be able to take a look at those as we continue through the presentation. But go ahead and put that in the chat box. And we'll get a sense of where everyone's at with allocation planning. Okay. So we're going to go very quickly over the allocation plan requirements and timeline. As I mentioned earlier, we're about 2 months from the deadline for submitting your allocation plan. And while it's not required, we do encourage you to use the HOME-ARP allocation plan template as you're developing and drafting your allocation plan. That template really will ensure that you're answering all of the required questions and have all the information in a way that's organized and easy to find and read. There are several required elements within the allocation plan, and we'll cover those requirements and provide some tips and best practices on them throughout the presentation, but we'll also have those topic-specific breakout groups if you have questions. So those are consultation, public participation, the needs assessment and gaps analysis, funding eligible activities, production of housing goals if you are going to do rental housing, preferences, limitations, and methods of prioritization, and then refinancing guidelines if that's applicable. So we really want you to kind of think about your timeline for your allocation plan, and we encourage you to use the allocation plan checklist to identify the next steps that you have remaining so that you can submit your allocation plan. Creating a schedule and working backwards from March 20th, 2023 really will give you enough time to think through all of those steps, submit everything in IDIS, and give yourself a buffer so that you're not having, the very last minute you're submitting an allocation plan. We also want you to think about your local processes. So, what does your citizen participation plan outline as to when you're going to publish public notices? What's the timeline it takes for you to get internal and administrative approval? What does it take to get your form signed from your designated authorized certifying official? And then if you have to be on any local boards, what does it take to get on their schedules? And make sure you're building that in your timeline as you're thinking about that last deadline date of March 31st. So under HOME-ARP, there are 4 qualifying populations. It's really important that your allocation plans are written in the context of these HOME-ARP qualifying populations. And they are different than the qualifying populations or populations that are served maybe in other programs, such as the continuum of care. We really encourage you to look on the HUD Exchange. There's a number of trainings that goes into greater detail about the different qualifying populations. So one thing that we really want to make sure that everyone is aware of, that if you're inconsistent with referring to the different populations that you serve, or maybe you refer to a population that's served by another program rather than the HOME-ARP qualifying populations, HUD may need to disapprove your plan. So it's really important that you kind of take a look at that, make sure you understand those differences and who HOME-ARP should be serving. So the next part of this should be your consultation. And consultation is really the first step in your allocation planning process, and it's when you're consulting with 7 agency types or organizations that you have to consult with. You must consult with each of these different agencies and describe that consultation process in your allocation plan. This is one of the handouts that's on the HUD Exchange that we would encourage everyone to take a look at. It's got great tips, tells you what the requirements are, and some suggestions on how to approach consultation. What we really want to make sure PJs understand is that, because you have to consult with all of these different organization types, you may need to think about beyond just your Region, you may need to be consulting with state agencies or regional agencies so that you're ensuring that you're consulting with organizations that serve all 4 of the qualifying populations. And in addition to listing the agencies and organizations that you've consulted in your allocation plan, you also need to write a narrative about your consultation process. There are some best practices about consultation and a few that we just want to kind of highlight for you. It's really important and helpful if you're presenting some educational material to your agencies and organizations. It really will help them better understand the HOME-ARP program, give them some information on who the qualifying populations are so that they can provide you the best possible feedback on the needs and services, the gaps in your community for the 4 qualifying populations. Just a few things to avoid when you're doing your consultation. You have to complete your consultation requirements specific to HOME-ARP. There are very different organizations and different qualifying populations than when you're doing your consolidated planning consultation. So you need to do consultation specifically for HOME-ARP. Consultations really give you an opportunity to gather data and identify those needs and gaps. And that can be something that's done concurrently when you're doing your needs assessment and your consultation. Again, like I mentioned, you're going to have to consult with each of the required agency types and identify those when you're doing your allocation plan. And track all of your engagements, whether that's you've reached out and you didn't receive any feedback, make sure that you're documenting that. You can summarize the feedback that you've received during consultation, but providing who you consulted and detailed records about the different groups that you consulted will really help demonstrate that you did all of the required steps within the allocation plan. And another thing that's really important to note is that consultation and public participation are 2 very different things. We'll talk a little bit more about public participation later, but the required groups for consultation are really the ones that you have to consult with. You don't necessarily need to use the general public and people with lived experience as part of your consultation requirements. Those would be good for when you're thinking about broadening your public participation efforts. So now I'll turn it over to Carrie where we can start talking about the needs assessment and gaps analysis.
Great. Thank you, Jessica. So I dropped the link in the chat to the HUD Exchange page. I think folks got it from the email that you received this morning with joining information and a reminder about the clinic today. That has towards the bottom a heading that's related materials and resources. It has the slides that we're going over today, as well as 4 handouts that were created for the clinics. And we're largely looking at those as we go through these slides. So if you want to see anything larger or spend a little more time looking at the images that you see on the screen, you can access them there. So hopefully that's helpful. Okay, so I'm going to talk a little bit about the needs assessment and gaps analysis, as well as then a few other topics, preferences, and finally public participation. So the choices that PJs make in your allocation plans about how to target HOME-ARP funding, those need to be data-driven and data-informed. So specifically, the needs assessment and gaps analysis requires that PJs gather and analyze data about all 4 of the qualifying populations, their size, demographics, and take a look at their unmet housing, shelter, and service needs and gaps. So here on this chart, we've listed the requirements, best practices to keep in mind to sort of help you meet those requirements, and then also how you show HUD that you've met them, how you demonstrate compliance. So the requirements include collecting and analyzing data to demonstrate your understanding of each qualifying population within the jurisdiction. So specifically, how many people are we talking about within the PJ, and what are their demographic characteristics? Additionally, PJs need to look at the available resources for each QP across the jurisdiction and understand which needs are being met and where the housing, shelter, and service needs and gaps exist for each qualifying population. And then that information should inform and support the PJ's determination of the most acute needs that you want to prioritize for your HOME-ARP funding. So some tips, some best practices include using the allocation plan template. HUD, created this template, they've improved it. And so, use that as a tool. And additionally, I think Jessica mentioned, but if she didn't, the allocation plan template with tips, there's a PDF version on the same HUD Exchange page where you find the allocation plan template. There's another link that's to a document with tips, and that's super helpful. It goes section by section and kind of talks about, make sure you're doing this, you're thinking about this, in particular for the needs assessment and gaps analysis. It provides some suggested data sources and things to think about as you're having to make extrapolate or make inferences based on the data that you have. Ensure that you get data from the applicable continuums of care and have a contact there who can help provide context for that data. Numbers don't always speak for themselves. There might be some caveats around them. So you want to have someone who can kind of help explain it to you. And then again, you use that information gathered to fill gaps in the quantitative data that you can explain. So, that you can obtain. So the consultation process and needs assessment and gaps analysis should sort of speak to each other. It's helpful to be doing those at the same time, or maybe if you get through consultation and you're working on your needs assessment and find, there's a question that comes up or a hole in the data, maybe you use some of the connections you made during consultation to go back and say, hey, can you help me figure out, what I'm seeing here? And then demonstrating compliance, make sure you include narratives in the plan. You don't just want to list all the data or data sources. You need to analyze it, talk about what it's telling you. And then make sure you describe all 4 QPs distinctly, as well as the unmet needs and service gaps for each. And I would say, make HUD's job easy to see that you've met the requirements. So because you have to talk about all 4 QPs, have a separate heading for each one and show that, okay, here's where we're talking about QP1, the literally homeless qualifying population, and so on. And then you use the data that you gather to inform the rest of your plan, right? You're justifying your priority needs determinations, the activities you intend to fund, and we'll talk about preferences and limitations a little bit later. But if you adopt any of those, they should be justified by the needs assessment and gaps analysis. Okay, so here I said there were some suggested data sources in that template with tips, but we've also got some here on this handout. So for qualifying population 1, continuum of care data can be really helpful, and that includes point in time count and data from HMIS. Do keep in mind, I think we've seen this, in some cases the boundaries of the COC and the PJ won't be exactly the same. And then you have to sort of do a little digging, make some estimates, and explain your logic in the plan. And there is a helpful tool. There's a COC PJ crosswalk available on the HUD Exchange that, if you're not sure what COC applies to your PJ, that will tell you. Then for QP2, this is the at-risk of homelessness qualifying population. You can obtain information from emergency and rental assistance programs. There's nationally available eviction data, as well as historical census of overcrowding within housing. And then you might also be able to obtain data from local sources, so people exiting institutions, so maybe your jails or criminal justice partners, as well as human services and health services, and other sources or other service providers that work with people that have that need services that sort of correlate with housing instability. For qualifying population 3, this is domestic violence, sexual assault, stalking, as well as survivors of human trafficking, and that's, again, both sex trafficking and labor trafficking. So there are data sources available there from domestic violence counts, then also the Migration Data Portal and National Sexual Violence Resource Center. Again, this is another area where you might have local providers that have data available for you. And then for QP4, there you might want to, that's other populations. It's sort of the most nebulous of the 4 QPs. HUD has provided their definition for how they determine, these other populations where housing services provided under the HOME program could facilitate housing stability. So there, you could look at, public housing authority waiting lists and wait time. So, what's our demand here for housing? Short and long-term rental housing data. I think in particular, right, coming out of COVID, there's a lot of rental assistance, so that might be a rich source. And then just other sources listed here, COCs, et cetera. Okay, some common issues to avoid in the needs assessment. Reasons that, I guess the most common reasons that allocation plans are not accepted for this section of the plan is a failure to describe all 4 qualifying populations within the jurisdiction and a failure to assess the unmet needs of each qualifying population and how the needs were determined. So I think I said that 3 times. Hopefully everyone, it hit home for everyone. Okay, now we'll move on to preferences, limitations, and methods of prioritization. These are optional to include within the allocation plan, but if you want to allow one QP qualifying population to access HOME-ARP, housing, shelter, and services with any method other than a chronological waiting list, or maybe you intend to give extra points to applications that serve a particular qualifying population, then you need to include, likely a preference and method of prioritization in order for your plan to be compliant. And that's a common mistake. We'll talk about that later, but people say no preferences, and then when they're describing their application method, it describes a preference. So a preference allows one member of a qualifying population or one qualifying population to be selected for assistance before qualified applicants from other qualifying populations, or it may even allow a member of a subcategory of a qualifying population to be selected ahead of all others. So in that case, it might be someone experiencing chronic homelessness within, QP1, that's a smaller segment of that group. So that might be, they might get a preference because of high vulnerability. A preference does not make anyone eligible for assistance who wouldn't otherwise be eligible. It doesn't make any other qualifying populations ineligible. And again, these should tie back to your needs assessment and gaps analysis. So, if your needs assessment is showing that QP2 has the least acute needs, you probably wouldn't logically be able to adopt a preference for that group unless there's some real serious justification going on. But that's the sort of thing, right? These things should tie together. Your plan is telling a story, making the case for how you want to spend your money. Okay, so a method of prioritization then is the process by which you implement that preference. And it's how PJs and referring partners determine how qualifying applicants are selected for a HOME-ARP activity or service. So there's an example here at the bottom. Say you did establish a preference for chronically homeless members of qualifying population 1. Well, okay, we have more than one applicant who is chronically homeless, so how do we decide amongst them? And there, the method of prioritization could be, for instance, the length of time that they were homeless. So there you really could, start to put them in order of, and that would relate to their level of need. Keep in mind that, a method of prioritization is only allowed when a preference is adopted. And when there isn't a method of prioritization, then you are allowing access based on a chronological waiting list, based on when people applied or were referred. And then finally, a limitation excludes certain qualifying populations or subpopulations of a QP from eligibility for an activity or housing project, for instance. Limitations should be limited in their use, and PJs can't adopt limitations in such a way that any QP is entirely excluded from access to HOME-ARP benefits. So I think, there's a policy brief about preferences, prioritization, and limitations, and in that it mentions, if you're a smaller PJ and only funding one project or one activity, then you couldn't adopt a limitation because you wouldn't be able to serve all of the QPs. If you do adopt a limitation, it should be necessary to address a specific gap in housing or services in the area. And there should be a reason that a preference wouldn't be enough by itself to address that gap. I think the common, easy example of a limitation is the case of domestic violence, sexual assault, and trafficking survivors, where a limitation may be necessary, for instance, for non-congregate shelter because of there's a necessary confidential location of the shelter. Okay, so on the back side of that handout are a few things to keep in mind. So your allocation plan needs to address how your PJ will provide all qualifying populations with access to HOME-ARP projects and services. So as you talk about preferences, et cetera, you have to also include how you're going to serve everyone or provide access to everyone, all QPs. Eligible preferences need to be called out in the allocation plan, but you don't have to describe the specific projects to which the preferences will apply. And I'll just mention as an aside, I worked at some of the in-person problem-solving clinics, and in reviewing a couple of plans there, something I saw quite often was describing specific projects that the PJs were intending to fund. And that's not something you have to do in the preferences section or anywhere within the plan. You talk about the activity you want to fund, how you're going to solicit applications, but you might be shooting yourself in the foot if you describe a specific project and then say that project doesn't work out, or you have sort of a program in mind that may end up not being eligible, to provide supportive services. You may have to go back and amend your plan, and you didn't have to include all of that detail in the first place. So you don't have to have it all worked out when you submit your plan. You just have to figure out, okay, our priority needs are these things, and this is what we want to fund. We might have some priority populations we want to serve, and this is how we're going to figure out, where those funds go, how we're going to seek applications, and leave it at that. So again, preferences should be justified by data. That's another thing to keep in mind. And then also remember that preferences and limitations can't violate fair housing, civil rights, and other non-discrimination requirements. So as you're considering adopting a preference, think about whether it might be either overtly discriminating or have a disparate impact on a protected class. Okay, so some issues here that HUD has seen with preferences that have led to disapproval or not accepted allocation plans include, including a method to solicit applications that applies a preference, or describing a project or activity that's targeted to a specific qualifying population, and then in the preferences section saying, but we don't have any preferences. If you will have any preferences, or you will allow your partners to implement any preferences, it has to be discussed in the allocation plan. Another mistake is commonly applying the wrong definitions to the qualifying populations identified for preferences. Again, adopting a preference that violates fair housing requirements, as I just mentioned. And sometimes, these make sense on their face. When I worked at a PJ, we had a service provider that did a lot of work with veterans, and they wanted to fund, it was housing in this case, project specifically for women veterans who had suffered sexual violence during their time in the military. Logical, right? It makes sense, but it wasn't eligible because it's discriminating based on gender, which is a protected class. So it's not something you can do. So here, the example is establishing non-congregate shelter that would serve only women and children. Not eligible because, again, discriminating based on gender. And then finally, a common mistake is saying that, coordinated entry will be expanded and used for direct referrals, but no preferences or method of prioritization will be adopted. So, inherently coordinated entry is a prioritization system, and you'd have to discuss, okay, who's rising to the top, what's our preference within this this system, and how are we making determinations on who comes first, second, third, etc. Okay, and finally, let's talk about public participation. So the HOME-ARP public participation requirements are in a few places. They're described specific to HOME-ARP in the HOME-ARP notice. You've also got Part 91 of the HUD regulations. That's your, con plan, action plan section or part of the regs. And then you also, to implement that, you should have an already existing citizen participation plan that can help guide you and in some cases put some of the meat on the bones of, okay, we have the requirements in the notice, in the regs, how are we doing it in our community? And that's what your citizen participation plan will tell you. And the notice requires that at a minimum, the public is able to comment on the amount of HOME-ARP funds available and the range of activities that may be funded. So when you do your public notice, that information should be included in that notice. And then, also want some of the, general obvious, like, where is the public hearing? What time is it? What day? And then also where to access the full draft plan, where and how to submit comments, and where and how to request language or disability accommodations. And then public participation requirements, not unique to HOME-ARP, but also stipulate that PJs undertake efforts to broaden public participation. And on the next slide, we'll talk a little bit about, some strategies to do that. Keep in mind that both a public hearing and public comment period are required. The public hearing should occur during the development of the plan and before it's submitted to HUD. And it doesn't matter, or there's no requirement about whether that's inside or outside of the public comment period. I think often it's during the public comment period, then you can do a combined notice for, our public comment period starts tomorrow, and our public hearing is, 8 days from now during the public comment period, and this is how you can attend or participate. One thing that is different about HOME-ARP from the regular public comment requirement is that the comment period only has to be 15 days. Typically it's 30, and PJs don't need to amend their citizen participation plan to take advantage of that flexibility. Some best practices, do's and don'ts. So some ideas to broaden participation include, in this day and age, I don't know, I read the newspaper digitally and the public notice section is very, very small. So I don't look at it there. So I might look more to social media to hear about things like that. So that could be a strategy to broaden public participation. You could also work with neighborhood organizations. Maybe there's a neighborhood newsletter in some of the communities that could help advertise that this funding is out there and that you're going through your planning process and taking comment. You could use other traditional media like television and radio. Also things like, think about where you're hosting your public hearing, and is it at an accessible time for people who are working? Maybe you want to do it in the evening or on the weekend so that more people can participate. You could also have it, at a more visible and accessible like community building or facility. And then to demonstrate compliance, you want to triple check that all the required information is in the public notice and it's accurate with no typos. You don't want to have to redo that. Submit a copy of that public notice and affidavit of publication, as attach that to your allocation plan and show, see, we did this, it meets the requirements. You can see for yourself, HUD. And you can also include, if you did a digital public notice, you could include a screenshot of that. Some don'ts, be thoughtful and make sure, you're thinking about the requirements as you're doing this. Don't just sort of casually gather input to develop the plan, but not provide a full 15-day public comment period. Again, triple check the public notice. You don't want to have any inconsistent or incorrect information on that and have to redo it. I would even say, how often do we look at things that, you all of a sudden you've looked at it for so long you can't see mistakes. So maybe ask a colleague to review that has fresh eyes, and they'll probably be able to spot errors very quickly. And then don't forget to describe your efforts to broaden public participation in the allocation plan. Some early plans weren't accepted because some PJs just didn't answer the question. So HUD isn't going to judge, whether you did enough to broaden public participation. You just need to make an effort and then talk about that effort. And then, I'll mention one last thing. It's not on the list, but it's something that I saw in the in-person clinics was sometimes folks were conflating public participation and consultation and saying, I saw one instance where, we consulted with this COC because we sent them our notice of public comment period. That's kind of cart before the horse, right? The consultation is supposed to happen early. That's when you're talking to stakeholders and hearing from them about to help guide the direction of your plan, hearing about the needs that they see out there. It's like qualitative information that you're getting from them. And then the public comment period is during the development or towards the end of development of the plan, where you have your ideas about what you want to fund or are forming them, and you want to solicit public feedback on what you're thinking. So, just make sure that they're somewhat related, right? We're gathering information from people outside of our agency in both circumstances, but you want to make sure that, those are distinct processes. Okay, so that concludes the presentation. And we're not going to do Q&A here. If you had questions that came up for you as we were speaking, please take those into the breakout sessions. As Jessica mentioned at the beginning, folks will be able to self-select. So I'm going to turn it over to Sharita to guide us in.